Well, pets can suffer from some of the same health problems humans do as they get older.
That includes arthritis, and Dr. Joel Conn from Pismo Beach Veterinary Clinic joins us this morning with more on that. You say this is pretty common.
This is really common. Actually, almost every pet over the age of 7 to 10 is suffering from some form of chronic pain. And arthritis is far and away the most common cause of that, just like in humans. So the main thing is identifying that. And that's the biggest thing, the biggest challenge that we have as veterinarians, and I think you have as an owner, is figuring out, is your pet in pain? Because most of them won't tell you. Your average goofy lab or golden is going to, have a happy, smiley face and a waggy tail, until their last day, but that doesn't mean that they're not suffering to some extent.
So you say that there are some good signs that you can kind of look for in your pet to see if they are doing.
So the main thing that I always hear from owners is when I ask, how are things going with Scruffy? Well, he's doing okay, but he's slowing down. And, I think a lot of people assume that that's a normal thing for an older dog or cat to go through, and to some extent it is, because it's very common for older animals to get arthritis. But slowing down is a very good indication that something's hurting. So things like dragging on the leash. You're going for your walk, and instead of being pulled along, you're pulling your dog along. That's a pretty good symptom that something's not right. Difficulty getting up and down. Spending more time alone or hiding. Not seeking attention. This is especially true in cats. They tend to sort of be very private about their medical conditions. A stiff gait, and then just difficulty getting up and down, especially getting up and down on a slippery surface, tiles or linoleum. And then, of course, if it's dramatic pain, you might see more obvious symptoms like panting, whining, difficulty, sort of settling down at night.
Now, what can you do to help treat this?
So there's lots of things you can do. I think probably the thing that a lot of people overlook is weight. So many of our pets today are overweight. It's estimated that at least 30% of the average household pets are actually obese, not just overweight, but obese. So weight loss is huge. It's better than anything else you can do. Better than surgery, better than medications, getting that weight off. And in a dog that's predisposed towards arthritis, especially these larger breed dogs like Goldens or Labs, having them even on the lean side of normal is a good idea.
Okay.
And the way you assess that is their ribs should feel like your knuckles, literally. Okay. So you should be to the point where if they take a really deep breath, you can just almost see a rib. That's a good indication. And then from that top view, you want to make sure they have a nice hourglass-shaped waist.
Okay.
So that's number one.
And so in order to do that, eating right and exercise, I'm imagining, just like people. As far as the food goes, I know I found that I was actually overfeeding my dog, didn't even know it. Something people really need to take into consideration.
So it's an interesting thing, because I have so many people that say, well, I'm only feeding him 2 cups a day. But if your pet's overweight, 2 cups a day is too much.
Okay.
So it's a very simple equation. If they're overweight, too many calories are going in,
okay,
or they're not exercising enough. And usually in an older pet, exercise is a tough variable to change. So what I recommend to people is cut that food back 20%.
Okay.
And you're looking for about a 1 to 2% weight loss per week is actually safe.
Okay.
We also see you have some medicines.
Yeah, so there's a few things with sort of the natural approach here. We've got fatty acid supplement, and glucosamine chondroitin, or MSM. These are very common. A lot of humans use them. In fact, we frequently use human products, especially in larger animals. Talk to your veterinarian regarding dosage, but they're very, very safe. The downside is they don't always solve the problem, but they're one of these things that can't hurt, so we will usually try them. Fatty acids and glucosamine supplements we know are not going to regenerate arthritic joints, but they can help with inflammation, they can help lubricate joints, and as I said, they're very safe, so good starting point.
And are these all available through just your veterinarian, or can you pick some of these up?
So glucosamine, chondroitin, fatty acid supplements are technically over the counter. There are some veterinary exclusive products, but you can get these at Costco, at Walmart, and check dosing schedules. What's on the bottle is not always what we recommend. Sometimes we actually go higher with our dosages. So, and a simple phone call to your vet can give you some of that information.
Okay.
And then if that fails, then we go to an anti-inflammatory, an NSAID, so an aspirin class of drug. There are some very good pet-specific NSAIDs out there that are going to be veterinary exclusive products. I do recommend not using human products here. Aspirin, ibuprofen, Tylenol can at times be incredibly toxic. to your pets. So talk to your veterinarian. And then, of course, exercise, is a big factor. Low impact exercise, leashed walks is really important, because if you don't use that muscle, you're going to lose it. And, lubricating the joints frequently, that kind of thing is important. So there's lots of things you can do.
Sounds like I need to take your advice.
Yeah, yes.
I know. Not just good for pets.
Not just good
That's
for
right.
pets. Well, if you have a question about your pet's health, email it to askthevet@kcoy.com. And we want to thank you very much, Dr. Joel Conn, for joining us this morning. And we'll be right back.